But first, it might be January, but it's never too early to think about your summer holiday, especially with the weather we're having right now. But it seems that more and more British people are combining a holiday abroad with cosmetic surgery. Now, last year Clarissa had not one, but 2 cosmetic operations abroad.
For decades, the British have been visiting Tunisia in search of sun and sand. But now an increasing number are heading here for surgery. 21-year-old Clarissa first visited Tunisia 6 months ago for a package holiday with a difference. She came back with some unusual souvenirs. Clarissa used to have a 32A chest, but thanks to a breast enlargement operation, she now has a 32 double D chest.
I did do quite a lot of research in the UK. It was ranging from around 3,000 to 4,000, and in Tunisia it's around about £2,000, which is a pretty good price.
She was so pleased with the results, she's now returning to Tunisia for liposuction with the same surgeon, Dr. Hamza.
Hello.
Hello.
How are you, Clarissa? Fine. Please come on.
When you look in a mirror and you see something that you don't like and you get fixated on it, it makes you more determined that you want to get it done. I don't like my thighs. I've never liked my thighs or my stomach. That's just, I used to work really hard at getting a nice flat stomach, but it just never worked, really.
All this fat will be sucked and the skin will redrop after. You like it?
Yeah.
After the initial consultation, surgery is normally carried out the next day. Dr. Hamza is one of 80 plastic surgeons operating in Tunisia. In the last 5 years, he and his colleagues have seen a 20% increase in clients from Europe.
The quality of a surgeon is very good quality of surgeon. All plastic surgeons have their training in France. We have them the same training like French doctors.
Oh, hello, Clarissa. How are you today? Is everything good?
Yes.
The surgery was very good. We took 3 liters of fat.
3 liters?
Yeah, 3 liters of fat. And now you will be new and your body will be remodeled.
Her purse is considerably lighter too. For surgery and a 5-day stay at the hospital, she's paying £1,000. Similar surgery in the UK is £2,000. It will take up to 3 months before the swelling goes down, but Clarissa is already pleased with the results.
I'm a little bit tender and sore, but apart from that, I'm okay. There is quite a lot of swelling at the moment, but I've had a little sneaky peek at what the results were, and good.
So there you are. Well, Clarissa joins me now along with Dr. Hilary Jones. Clarissa, how are you feeling now? Because you looked in a bit of discomfort immediately after the operation. How are things now?
I'm much better now, actually. It was very painful to begin with, but it's better now.
It's better now. Now, the first operation you went for was the breast enlargement, wasn't it, or breast enhancement? And that went so well that's why you decided to go back, because you didn't have any problems at all with that.
Well, the discussion was to have liposuction over there at the same time, but because I didn't have enough money and the time off for work and stuff, then I wasn't able to do it, so I had to go again.
Right. And did they recommend to you to actually have it done separately?
Yeah.
Okay, so they had that responsibility to do that. We can see before and after with our nice little sort of little spraying your modesty there, our wee white squares. That's quite a dramatic difference. Are you much happier with the body that you've got now?
Definitely.
You really are.
Yeah, I'm glad I had it done.
How long did that take for you, for it all to heal and for the pain to go away?
Within a week.
Really? It was that quick?
Yeah.
It was that quick with the breast enlargement? And how much did you save, do you reckon, by going to Tunisia to have it done?
Thousands.
Really?
Yeah, because, you couldn't go on holiday for half the price of what I paid as well.
And also, when you were there, did you have time to recuperate? We saw the beautiful surroundings.
Yeah,
you had time to recuperate there. So, no hesitation about going back. You went back to have the liposuction. I have to say, watching the pictures of you before, you didn't need it. You looked fine. You looked more than fine. You looked absolutely beautiful. But you wanted just to be sort of more contoured?
Yeah, you work out in the gym and stuff. You see results, but you don't see it as much as what you do after an operation. I can see more definition after I've had a workout now.
I mean, I can't really see all that much difference between the two pictures, but you're saying the jeans you've got on, for example, today, you were saying you couldn't have got into them before.
No.
And
definitely
you've
not.
noticed a real difference with your clothes,
Yeah.
and how you feel. And also, it's made you feel better?
Yeah, I'm more confident now. I can wear, I mean, when I used to go shopping, I used to go in the shop and go, no, it doesn't look right. You know, I couldn't wear it.
You're a beautiful girl. It's worked out brilliantly for you, but you're also a bright girl because you did an awful lot of research, didn't you?
Yeah, it is very important to do that beforehand.
Right, and you made sure that you were going somewhere absolutely bona fide, and you checked it all out. Because, Hilary, that's the thing. You know, this all sounds fabulous, doesn't it? All sounds absolutely brilliant. In Clarissa's case, it's worked very, very well, but you do have to be awful careful. You have to be as sensible as she's been.
You do. Clarissa's done really well, and that's fine. But travel and surgery don't always mix that well. For various reasons, and certainly it's fraught with potential difficulties. For every one of Clarissa, there are lots of other people who've had bad experiences.
Yeah.
So I've got some tips that I would, tell anybody to bear in mind. Firstly, always check the surgeon's credentials. Make sure that the surgeon who's going to operate on you is experienced, has the skills to do it. There are plenty of Eastern Bloc doctors who can earn, up to a year's salary in one operation, but they haven't got the experience. Yeah. So there's no point going to somewhere where the surgeon isn't well enough qualified. Find out who the surgeon is and try and get counselling pre-operatively from that same surgeon. There's no point seeing a surgeon here in Britain and then going abroad to see his junior medical student.
Indeed, that's right.
Big problems if that happens, and perhaps no redress as well. I think thirdly, find out from former patients if they're happy. If they can't supply the names of 2 or 3 people who've come back from that clinic abroad and can say, I had it done, he or she is a really nice surgeon, they put me at my ease and I'm really pleased with my results. There's something wrong if they can't do that. So speak to former patients. I think find out about aftercare. It's really important. There's no point going abroad, having surgery and then coming home and there's no one to pick up the pieces if something goes wrong. So if there's bruising, infection or swelling, who's there to help? You might find yourself faced with another bill having to go privately to correct something if it's gone wrong. So who's going to look after the aftercare? Good surgeons will have reciprocal colleagues over here who can see you if there's a problem. And I think finally, check their medical indemnity. If the doctor isn't insured, then if something goes wrong, you're up that creek with no paddle. So make sure they've got cover so that if there is a problem, you can claim off the doctor and the doctor is covered with defence insurance to look after you.
Because not everybody's as lucky as you, Clarissa. You didn't have any post-operative problems at all, really, did you? But mind you, you're young, so you've got that on your side too. But you were absolutely fine. Are you going to do any more? You don't need to, I hasten to add, but is this you now? You're fine?
Well, for the moment, yeah, but I'm not addicted or anything like that. I wouldn't say, go and have loads of stuff done. I would just say, if there's something that you've wanted done, for quite a while. I mean, I wanted my breast done since I was 11 years old. So, our girls are growing up and maturing and stuff, I was like the odd one out that wasn't growing.
So you felt that you wanted to do that for you.
Yeah.
And has it made a big difference to your life?
Yes, really it has. I mean, I've got a lot more confidence. I can wear underwear now and feel confident in underwear, because beforehand, you needed padding and stuff like that, and it doesn't make you feel any better having the padding. So, I mean, if the thought of going under the knife, I mean, I didn't have a problem. I was so desperate to have it done. It didn't really matter to me.
Okay, well listen, well done you. It's worked out for you, which is fantastic, and thank you very much indeed, Clarissa. Good to see you. And Hilary, your tips, you've got to make sure that you do what Clarissa's done, check it all out.
Be careful.
Thank you very much indeed. And if you're considering plastic surgery abroad, do make sure you check out all Dr. Hilary's advice. It's featured on the website GM.TV. And if you've been abroad for surgery, do tell us about your experiences. Did it change your life for the better, make you more confident? Perhaps it was a complete disaster and ruined your life. Whatever your story, good or bad, we want to hear from you. And you can text us from your mobile. The number is 81189. That's 81189. Remember to text your name at the end of your message. You can, of course, email us at gm.tv.